Okay, this podcast is going to cover neurologic assessment, which is found in Module 11, the concept of intracranial regulation. Here are your learning outcomes. And this should be review from A&P. Remember that we have the central nervous system and we also have the peripheral nervous system. We need to make sure that we are assessing the whole thing. Genetic and lifespan consideration. Typically, infants have very primitive reflexes at birth. Sucking, the Babinski reflex, the startle reflex, the rooting. You'll learn more about that when you have maternal and child newborn. Children develop fine and gross motor skills as they develop. And older adults. Please remember that a decline in mental health status is not a normal part of aging. Just because somebody is elderly does not mean that they're going to have any dementia. Anxiety, illness, pain can affect learning by elderly. Short-term memory is usually less efficient. They may be able to tell you what happened 20 years ago, but they can't tell you what they had for breakfast that day. Depression is more common. There are oftentimes vision, hearing, and the ability to smell is usually decreased. Decreased reflexes, but yet these tend to be normal for somebody who is elderly. Alterations in intracranial regulation. There is a pattern of manifestations. And they usually follow a predictable progression from losing higher functions to the more primitive functions later. Early manifestations can be an altered level of consciousness, behavior changes such as confusion, agitation. So when we're talking about orientation, is the patient alert? Oriented to person, place, and time. This is something that we're going to talk about in class, but again, it's oriented times 3. Do they respond to verbal stimuli? Are you able to talk to them and they become alert, they wake up? Show decreased concentration, agitation, confusion as the brain function deteriorates. To the point that they may require continuous stimulation to be aroused. They don't wake up easily. You may have to do that sternal rub. Shows no response to stimulus. This is going to be somebody who is unconscious. So alterations in level of consciousness. You have consciousness is an individual that's aware of their self, environment. They're able to respond appropriately to stimuli. And alertness is one thing that will usually indicate that there is a problem. The RAS system regulates wakefulness, sleep, and wake transitions, promoting motor control of posture, so these things can also be affected. Cognition, the process where individuals learn to store, retrieve, and use information. Again, they may become very confused. Arousal and cognition depend on normal physiological function. So alterations. Consciousness is a very dynamic state. There are a lot of things that can cause an altered process of level of consciousness. Lesions, injuries to the brain, metabolic disorders, some medications. Brain function depends on blood flow. You have to have blood, oxygen, and glucose to all the parts of the brain. So when there is something that destroys or compresses neurologic structures, you're going to have the level of consciousness is going to be affected. Any condition that affects the delivery of blood, oxygen, or glucose to the brain also can affect level of consciousness. Other metabolic alterations, fluid and electrolyte imbalances, acid-base balances, accumulation of waste products from liver or renal failure. There are drugs that will suppress the central nervous system, and ischemia, or lack of blood supply. Things such as hematoma, hydrocephalus, tumors, infection, injury. Prevalence, 1.7 million traumatic brain injuries a year in the U.S. That's an awful lot. Adolescent and older adults, especially males, are at a much higher risk, typically because they tend to be more risk takers. Falls are a leading cause. So determining somebody's neurologic status may be part of a health screening. It may be because of a chief complaint, or it could be part of the total health assessment. We need to focus on the chief complaint. If somebody's level of consciousness is altered, it is okay to rely on the family for information. Using the Glasgow Coma Scale is something that we would do for anybody who has an altered level of consciousness. And with infants, children, and older adults, again, we need to make sure that we're taking into consideration developmental stages. So this is the Glasgow Coma Scale. You don't need to memorize this, but just be aware that this is most commonly used, and the higher the score, the more awake, alert, and conscious a patient is. Do they open their eyes spontaneously? Are they oriented to person, place, and time? Do they obey commands? And the total score can be as high as 15, which would be a normal, healthy adult. 8 or less is usually somebody who may be in a coma. So they may still have some response to verbal words, and also to pain and touch. A totally unresponsive patient probably has a score of about 3. Okay, no response in any of those areas. So again, just be familiar with this, that it is a matter of assigning numbers. Okay, so assessment, you're going to start with your general questions, and we're going to talk much more about these in class. On page 697 at the bottom of the page, there's some good general questions. You want to know if they've had any illnesses, any infections that can affect the brain, or any injuries. Do they have any symptoms or behaviors that indicate there might be a neurologic deficit? Infants, children, pregnant female. Again, we're going back to the considerations of the developmental age. Pain, do they have any pain? Behaviors, the environment, is there a change in the environment? One thing to remember with older adults is to give them time to answer question. It may take them a little longer to process the questions you're asking, and they tend to become tire much more easily. Page 707 has a review of the lifespan considerations. You can just look over that. So the assessment, we want to know, we're going to check their mental status, their cranial nerves, not all the cranial nerves, we're just checking a few of them, and their cerebellar function. Assessment of cranial nerves in an unconscious client is going to be difficult. You may or may not be able to do that. So this is what we're going to talk about in class. You're going to use your practice rubrics to go through this. Level of consciousness, we're going to talk about. If somebody is unconscious, then you need to use the Glasgow Coma Scale. Cognitive function, orientation, communication, and then cranial nerve. 3, 5, and 7 are the ones that we're going to check. I know your book goes into a lot of detail about checking all the cranial nerves, and for all intents and purposes, these are the only ones that you need to be responsible for. And like I said, we're going to cover all that in class. I'll demonstrate. We'll talk about how to do these assessments and the kinds of questions to ask. So this is just a very quick, short documentation. Date and time, always first. And again, patient is understood. We don't have to, put the patient there. Well-groomed and relaxed with good eye contact, alert and oriented ×3, speech is clear and appropriate. Immediate and recent memory intact, meaning their short-term memory and their long-term memory. Cranial nerves 5 and 7 are grossly intact. Perla, this is with the eyes. Strength is +5 bilaterally, gait smooth and coordinated without tremors. So this is just an example of documentation, and we're going to be talking more about that. So this ends the podcast for your neurologic assessment. Again, look back at your book for information about this, but we are not doing a total every nerve assessment. Just stick with the ones that are listed here. Okay, that's that.